Hello everyone. So today we have Dr. B.J. Srinivas with us. Dr. B.J. Srinivas is a medical oncologist and is currently associated with HCG as consultant medical oncologist. Welcome, Dr. Srinivas.
Thank you.
So, Dr. Srinivas, the first question which comes to our mind is about the treatment options which are available for the management of cancer today.
Yeah. So we have three basic modalities of treatment in cancer. So mainly the surgical oncology, where it deals with the removal of the cancer by surgery. Radiation oncology, where it is radiation is given to the cancer parts, and medical oncology, where it deals with the drugs, mainly the chemotherapy, biological therapy, and the immunotherapy.
So that was quite crisp and simple. So can you throw some light on chemotherapy? What chemotherapy actually is?
So, in explaining in a simple analogy, so usually whenever the patient is having infection like throat infection or any other fever is there, usually they will take antibiotics. So, antibiotics mainly used to kill the bacteria. So, similarly, the chemotherapy is a drug where it will kill the cancer cells. So, that is what we called it as a chemotherapy.
That was simple and sweet. So, how is chemotherapy administered? How do we give it?
So we have oral chemotherapy and the IV chemotherapy. So most probably most of the patients requires IV chemotherapy. So IV chemotherapy usually we give it in a three parts actually. One is peripheral IV cannula, or the other devices are available like chemo port and the PICC line is available. So usually we prefer more of this PICC line or the chemo port where it is administered into the larger veins and thereby causing less damage to the surrounding tissue. So a peripheral IV cannula is less often used.
Okay. So, having been mentioned about it causes less problems to the patient. What are the other problems or side effects which an individual may go through or may expect when they are on chemotherapy?
Yeah. So we can divide this into acute side effect or the chronic side effect. Acute means within 3 to 4 days of taking chemotherapy itself, the patient experiences the symptoms. So most of the side effects are like vomiting, loose motion, hair loss, tiredness. The blood counts may go down and fever may come. So these are the expected side effects. Chronically, it depends upon the specific drugs. Like some, for example, some drugs can cause injury to the cardiac tissues, renal, kidney damage they can cause. So depending upon the different agent, we can manage the side effect of these patients.
And this is what we can expect, the patient may expect.
Yeah.
Apart from that, we have also heard a lot about biological therapy, immunotherapy. So, in day-to-day routine, we read about it. So, can you throw some light upon both these
Yeah,
therapies?
biological therapy and the chemotherapy are little bit different from the chemotherapy. So usually biological therapy, what it does is it targets only the cancer cells, whereas chemotherapy it kills cancer cell as well as the normal cells, and thereby the side effects are more.
Okay.
So biological therapy it precisely targets the cancer cells, and the side effects are less and effective will be more. And immunotherapy, what it does is, which has recently come into our clinical practice. So it activates the body's own immunity to kill the cancer cells. So thereby minimizing the side effect and maximizing the effect on the cancer.
So, Dr. Srinivas, what advice would you like to give to our audience and the patients who are listening to us about chemotherapy, about the whole process?
The first and foremost I want to tell is don't decide you are taking chemotherapy or not taking chemotherapy depending upon on your relative or your neighbor's decisions. Please consult your oncologist or the clinician and then take a decision. And while taking the chemotherapy, don't take your supplements with any alternative medicines. There may be some interaction with these drugs, and chemotherapy is almost always required for any type of cancers, and there are more evidence that it will control the symptoms and improve the quality of life. And now there are more biological therapies and immunotherapies are available, and we can combine with it, and thereby we can reduce the side effects of the chemotherapy.
Thank you so much. Thank you so much, Dr. Srinivas. I'm very sure that the audience who is listening to us will definitely get benefited with all this information. Guys, if you have any comments, any questions to be asked, please don't forget to write it on the comment box below. Thank you so much. Thanks a lot.